Meantime, the House Ways and Means Committee will be having a full committee markup on America's Affordable Health Choices Act tomorrow. And with the preview now, Congressman Eric Cantor, the minority whip, joins us. Man, where to begin, Congressman? The Times says that House Democrats are jubilant in their words, and I guess the question will be what Republicans are going to do about this.
Well, Carl, you know, it is astounding, the breadth of this bill. And look, everybody wants to do something to help health care reform along, but this is nothing but a job-killing, tax-raising measure that will actually take away the quality of care that we've become used to, and in a recessionary time that we're in, will kill jobs. So it doesn't make any sense. We're going to try and raise these issues, try and improve this bill, but certainly looks like Speaker Pelosi's got this thing on a fast track.
So when it comes to the surcharge tax on people with higher incomes, or the mandate, the penalties for employers that don't cover or that don't provide insurance, do you have to pick and choose which you have to fight, or can you fight them all?
Well, first of all, I mean, what we're talking about here is employers with payrolls at $400,000. And studies have indicated you're talking about employers who employ maybe 5 to 9 people.
Right.
And they're going to have to pay over $30,000 extra a year right now, where they're having difficulty paying the bills as it is and maintaining their payrolls as they are. So it just doesn't make any sense. Again, we ought to be looking at trying to do this in a way where we maintain the system that we got, reduce the cost from the system so that we can help promote job growth right now, as well as provide Americans with the kind of health care they're used to.
But I guess my question is, are there aspects of it that you find more egregious than others?
Well, the really egregious aspects of it are the way that the Speaker Pelosi and Charlie Rangel and the Democrats want to go about penalizing those who are successful. And okay, their surtax does go and it charges the rich more. But what it also does is it taxes small businessmen and women. If you look at the group of people that they're targeting with this tax of incomes over a couple $100,000, in that group is about 50% of the folks who derive at least 26% of their income from small businesses.
Right.
So if we want to grow jobs, why is it that we would want to tax job creators and make it more difficult, more expensive for them to create those jobs?
We had this go around with when the budget was up in the air, and people were asking, all right, well, what's then the Republicans' alternative? How are you going to finance these shortfalls then in health care?
Well, the Republican alternatives are out there, you know, and we've got to go about reforms. Number one, we know where the examples in the private sector have taken place where they've actually reduced costs. You know, some of the large employers that operate under ERISA have demonstrated if we give them flexibility, allow them to provide some incentive for individuals to improve their behavior as far as their health is concerned, they're able to bring down and manage costs. That's number one. We ought to be going about trying to do that. Number two, the Medicare system in and of itself, as we know, is one big price-fixing system because you've got the best hospitals getting reimbursed the same as the worst, same for the doctors. We've got to go in and implement a merit pay type of system of pay for performance. People who can provide more efficient quality care should be rewarded for that. And then lastly, we do have to begin to provide incentives to individuals to get into the game. And this was a lot of the discussion in the 2008 presidential campaign, where John McCain had come out and said that he wanted to provide individuals the ability to purchase health care insurance just like employers have and give them the tax benefit.
Right.
We've got to move in that direction. Ultimately, that will help bring down costs. You can't right now do that by taxing employers and requiring individuals to play, and if not require them to pay, that's a job killer. We just can't afford that.
When we watched the cap and trade vote in the House the week before last or whenever it was, the sense was they revived it, but just barely, and it's not going to go very far. Are you sensing the same dynamic with health care? Is this going to get large support on the fringe and run straight into a brick wall?
You know, Carl, I am. I think so. I think that this is another one of those examples where the agenda by Speaker Pelosi is so far outside the mainstream that most people in this country are really beginning to scratch their heads and really asking a couple questions. One, who's going to pay for all this? And obviously, in this bill, the small businessmen and women are going to pay for this, as well as working families. And number two, how is all this going to work? It just doesn't seem this is the America that we know.
Hey, Eric, if you You talked to this guy at Safeway yet, this Bird guy? Why don't you fly him down to Washington to talk to these guys?
We've had Steve Bird in. We've had him in several times. And that's exactly right, Joe. Those are the kind of employer plans that we need to be promoting. And that's certainly demonstrable there. When you provide incentives for individuals to be healthier, you help their health care all over and you bring down costs.
We're certainly, this is a big proposal we're talking about here, and they haven't done, how much did the Safeway plan cost to implement? They've had zero price inflation, just right along with regular inflation. How much did that cost compared to what we're talking about here, Eric? And the type of dislocation that we're talking about to the entire system.
Well, what you have, though, Joe, is a fundamental difference about where we need to go with health care. There are folks in this administration. I met with the health care czar not too long ago, Nancy Andaparle. She and I had a discussion about why she thought we needed a government competitor to, quote unquote, keep the private sector honest. But behind that suggestion is the suggestion that we should remove the slice of cost which represents profit incentive, because if we take that out, the government can operate without it and keep everybody else honest. Again, we have never seen any party in this town reduce costs, either one, and where we know there's been success, like the Safeway plan and other large employers,
right,
we ought to be promoting that.
Congressman, if people weren't watching before, they're definitely watching now. I'm sure we'll talk to you in the days ahead.
Well, thank you all very much.
Congressman Eric Cantor.